I am Ramaswamy Govindan, a medical oncologist and a professor of medicine at the Washington University School of Medicine in St. Louis. The question is, what are the salvage therapy options for patients with small cell lung cancer? And I presume that patients who progress have received in the past platinum etoposide and desiluzumab or durvalumab. And when they progress, it is really a challenging issue. I want to speak first about what research is currently ongoing, and then I'll talk about what we know in terms of clinical trials and where we are going. One of the big challenges in small cell lung cancer is that we see these patients respond dramatically to the frontline chemotherapy with or without immune therapy agents. But then within 4 to 6 months, they progress and then they have a fairly, resistant disease. So one of the mysteries has always been what's driving these tumor cells to go or become resistant to chemotherapy at such short intervals. If you look at the biology of small cell lung cancer, we know that it is a disease where two critical genes are disabled concurrently. That's P53 and RB. And it's been proven over and over again that this is very critical for small cell lung cancer. We don't see the classical oncogene mutations in small cell lung cancer typically. Oncogene activation like EGFR mutation or ALK rearrangements, etc. in this disease. We see MYC amplification, others, but not generally we can target with targeted therapies. And we don't know much about what happens at the time of this resistance. And in fact, we did a study a while ago where we took biopsies at the time of relapse and did whole exome and transcriptome sequencing. We obviously found, again, P53 mutations and RB deletion. We also found that these tumors have upregulated the Wnt signaling pathway, and that we showed in functional studies that activation of the Wnt signaling pathway promoted chemotherapy resistance. There's also some evidence, at least from melanoma and hepatocellular carcinoma, that when Wnt signaling goes up, there is resistance to immune checkpoint inhibitors. So these things are promising. We need to prove that in other independent studies. And if that is true, we need to come up with ways to understand how to overcome the resistance. And this is an active area of research. The National Cancer Institute is funding research programs to study the mechanisms of resistance in small cell lung cancer. And there's an active consortium currently ongoing. And I'm very optimistic that through these studies, and also including single cell sequencing, and other technologies, we may be able to unravel the mechanisms of resistance and hopefully we'll come up with rational therapies. It's still some ways away. So what do we do in practice? The approved agents are topotecan and more recently the lurbinectedin. And we also have, in the past, we had approval for nivolumab and pembrolizumab, so that's no longer the case. And these checkpoint inhibitors have shown modest activity if patients have not received checkpoint inhibitors before. But then, unfortunately, the definitive study with nivolumab comparing with topotecan did not turn out to be a positive one. So this is no longer approved for the indication. So in practice, approved agents are topotecan and lurbinectedin, and in some countries, other agents are approved. In practice, I have used often irinotecan, either as a single agent or with platinum combination, and I've seen activity in fairly durable responses. Off protocol, if we have been able to get nivo-ipi in these patients, I've used that combination and we've seen some durable responses. Again, these are anecdotal, not supported with level 1 evidence or approved for this indication. So in practice, I've used irinotecan with platinum, nivo-ipi, and of course, we've used single agent gemcitabine and all-beam taxane. And I think the recent approval of this novel agent has some interest, that lurbinectedin, and I'm hoping that we can build on that. But I do think we are missing a fundamental piece here in small cell. We don't understand why these tumor cells become so resistant so quickly after being so responsive to platinum-based agents. And I'm hoping that our research and others will help us understand this and devise better therapies. And to me, that's where the future is, even though it's going to take us a while to get there. We just simply cannot do empiric studies. We've been doing this for a number of years and haven't made any progress, and literally in 40 years, barring a few advances here and there, as we discussed today.